My name is Karen Paklibar. I'm going to do a cardiovascular exam today, and this is my 360 view. Okay. So today, friends, I'm going to do a cardiovascular exam for you, okay? So first, I'm going to check your jugular venous pressure. So I'm going to put the light in it so I can see and inspect any occlusions. So right now, I don't see any occlusions. Also, carotid pulses are also visible, and if you can rotate a little bit to your left as well. And then no elevation as well, okay? I'm also gonna lower this part, and then also I'm gonna assess any untoward pulsations, which I don't see. Also, the maximal point of impulse is described as like within normal limits. It is at the mid-clavicular 5th intercostal space as well. So I'm gonna check on that one. I'm gonna pull up this top of yours. Just I'm gonna assess that one, and I don't see and then chest is equally bilateral as well, within normal limits as well. Visible, they're both bilaterally visible. Next, we're gonna do palpation, okay? So I'm gonna palpate your carotid. Palpable, strong and equal on both sides. And then there's no thrills that I palpated as well. The angle of Lewis is from the jugular notch at the 2nd intercostal space. This is where the angle of Lewis, also known as a sternal angle, center of the chest wall as well. And then on the right side of your sternal border in the 2nd intercostal space is the aortic area. And then the left side of the sternal border, or the right side, it's the left side, is the pulmonic. Pulse is good. Impulse as well. And then no thrills for both sides. And then let's move on to the tricuspid. Tricuspid is at the 4th intercostal space, and it is at the left lower sternal border. No thrills or abdominal pulsations. And then for the mitral area is at the 5th intercostal space, mid-clavicular area, just below the bra line for a female. And it's there's no pulsations. There's no abnormal pulsations, and impulses are palpated. Point of maximal area is at the same area, almost the same spot of the mitral, and it is I can feel like the amplitude is normal and non-sustained. I will do the auscultation for all those sites, but I'm gonna start first with the carotid area. Okay, remain still, friends. I want you to hold your breath. No boots auscultated, bilateral. I'm gonna also do your aortic. S1 and S2 is heard. Pulmonic. S1 and S2 is heard. No extra sounds, no murmurs. Rate is regular. Tricuspid S1 and S2 is heard. No murmurs, no extra sounds. And also I don't hear any thrills. I also next is the mitral, which is at the 5th intercostal space. S1 is louder than S2, no murmurs or extra sounds like rubs or clicks or gallops. I will do the same procedure using the bell, okay? Rate for all sites is equal, normal. Rhythm is regular as well. Aortic. Normal rate. At like 72. Pulmonic. Normal rate. Rhythm is regular. Tricuspid. Normal rate and rhythm is regular. And also for the mitral, normal rate and rhythm is regular. Now, what next is for, if you could turn, because I'm gonna do left sternal apex, if you could turn on your left side slightly, so I can palpate, and also, I can auscultate the left sternal, okay?
Okay.
There is no S3 and S4 noted, no extra sounds. Okay, friends, are you able to sit down? Maybe facing. So I'm gonna do this. You can cover that. No S3 S sounds heard, no murmurs. Can you lean forward? No S3, no S4 sounds heard. No murmurs, no extra sounds, no gallops. Can you inhale? Hold a little time. A little bit, and then exhale. S3, no S3 and S4 noted. No also extra, no extra sounds heard as well. I'm gonna do also the bell so I can see. Just sit upright, friends, just for the left sternal. Okay, and no extra sounds. S3 and S4 is not noted. Okay, now I'm gonna do, if you can sit on the other on the chair, I want to assess your legs. Okay, so I have here, Miss France, skin is pink. I don't see any discoloration, no ulcers, no swelling, symmetric bilaterally, and then skin color and nail beds are pinkish with less than 2 seconds capillary refill. I'm gonna assess your brachial area, friends. I'm gonna assess your brachial. And then other side. pulses are equally bilateral, and then your radial pulses are equally bilateral, ulnar equally bilateral pulses. Also for the skin color of the legs are also like symmetric in size. There's no swelling noted. I don't see any pitting edema as well. No, hair is evenly distributed. Skin color is within normal limits. Nail beds are also normal. Capillary refill is less than 2 seconds. And then no rashes or ulcers. Now friends, I want to also make you stand and then turn your back so we can see any signs of any varicosities, and there's none for both legs, and that's good. For the arms, I've already palpated the brachial, which is equally bilateral, and then the radial as well, equally bilateral. There's no nodes for epitracheal that is palpable so far. Also graded is +2 on upper, both brachial and also radial. Capillary refill is within less than 2 seconds. Okay, and then also for temperature is warm to touch on both legs. Pulses also, I'm gonna check for your popliteal. Okay, equally bilateral. And then I'm gonna also for your dorsalis pedis. Okay, and then also your posterior tibialis is also all grade 2+, grade 2+, and then I don't see any pitting edema, none. With what we're gonna do, friends, is also I'm gonna do your inguinal nodes. If we could lay back again so I can focus on that. We're gonna raise this a little bit, okay? So inguinal nodes, this is where we also check our femoral pulses. And then so far inguinal nodes are non-palpable, small in its size but not really dominantly big. And then also on the other side, no swelling. Temperature is also within normal. Okay, now we're gonna do the Allen test. Okay, if you could close, have a fist, and then try to release your hand. Okay, so I can see less than 5 seconds or less than 10 seconds, and then close again and try to release. Okay, close again, try to release. So I can see less than 10 seconds. The next one, release. Okay, close again, release, and then close again, release. And then can you raise your legs, friends, on both legs so I can see also, I can identify if there's any pallor which develops. Okay, and then put it down so it's less than 10 seconds, and feeling the veins of feet and ankles in 15 seconds. And then if you can sit down and dangle your legs, I can see that there's also less than 10 seconds of circulation, or like back they call that one, the back flow of your veins or your blood circulation is also good, less than 10 seconds. And that concludes and also in the lungs, the ankles as well, there is less than 10 seconds of feeling of the veins. Other than that, there's nothing discoloration. And that concludes our cardiovascular assessment or examination.